Welcome everyone. We're joined today by Dr. Abraham Morgentaler. He's one of the foremost experts on testosterone, author of Testosterone for Life, and associate professor at Harvard Medical School. Dr. Morgentaler, thanks for joining us today.
Great to be with you.
I'm excited to talk to you about men's health and testosterone, and also kind of give folks a little bit of a greater understanding of your background and also where this interest stemmed from. I think it's a topic that there's a lot of myths and misconceptions around, so I'm looking forward to chatting about your expertise and also kind of dispelling some of those myths and giving people the actual information based on research and what you've experienced over your career.
Great.
So can you kind of take us back, several decades as far as going from more of a urology background into your focus today? What was kind of the primary shift that you were observing either in patient practice or in your research that said, this issue of testosterone and declining levels is a significant issue that I really want to explore?
Yeah, it's a funny story. Sometimes, our careers start off from the strangest kinds of experiences. So actually, before I went to medical school, I worked in a laboratory for 3 years, and I worked with lizards. Okay. And it so happens that if you remove the testicles for a male lizard and you put them in a cage with the female, they don't do any of their normal sexual behavior. They have no testosterone.
Right.
And I had a project that took a while to work out, but eventually it did, where I actually was taking little bits of testosterone and putting it in the brains of these little lizards, specifically in their sexual centers. And when I was able to do that successfully, those males, even though they didn't have any testosterone circulating in their bloodstream, would see the female and they'd go through their whole sexual behavior. They got this bright colored flap of skin that would come out, and they would mate. It was amazing. And what I got out of that was that testosterone, amongst other things, was a brain hormone. And it was important for sexuality. In medical school and in 6 years of residency in urology, we didn't learn too much about testosterone, except we lowered it for men who had advanced prostate cancer. Testosterone was considered to be bad and dangerous. And when I finished my training in 1988 and I started practicing at Beth Israel Hospital, now Beth Israel Deaconess Medical Center, which is part of the Harvard system, and I saw men who had sexual issues, we didn't have much to offer them. Viagra wouldn't show up for another decade. And I wondered whether men might be like lizards. And it turned out that they were. And so I tried testosterone on a couple of these men, and testosterone back then was barely used in the United States, mainly because of this fear that it would cause prostate cancer. And there was no generalized understanding that it might help men with all the symptoms that today we know are associated with testosterone. And once I saw some of these men respond well, I thought, oh my God, there's a lot of this. As I started checking blood levels in these men and hearing them and seeing them respond. And I said, there's something that's really here.
So essentially what you were noticing, quality of life improvements, changes essentially in their biofeedback, their biochemistry, overall libido, energy levels, and things like that. But testosterone wasn't quite yet that mainstream treatment. So after knowing that you had done the initial research on lizards, you had this patient experience with these few men, did that essentially lead you to, okay, I want to organize some form of study on this, or I need to get into more patient advocacy for the use of testosterone, also understanding now, looking at it from the perspective of both reproductive health, but also, as you mentioned, kind of this powerful hormone or chemical messenger for the brain. So what avenues did you begin to explore after that initial patient experience of this is actually, substantially improving these individuals' lives?
Yeah. So, there was no aha moment where I saw everything that testosterone would later become. It was really just I had these patients, and as a doctor, I was just trying to help them. And testosterone was one of the things that I was offering, but none of my colleagues were. So at that time, in order to get testosterone in this country, you had to have some major medical problem, like a tumor in your pituitary gland, which controls indirectly the secretion of testosterone from the testicles, or you had to have lost your testicles from cancer or trauma or something like that. And the idea that somebody could have a normal pituitary gland, 2 testicles, and still have low levels of testosterone and have that affect their lives, that was not known. It was not known. Nobody was doing that work. And because of the fear of prostate cancer, it was actually kind of scary for me to do that. And it was really just trying to solve a problem with patients. But what happened over time is, and so I became very careful around testosterone and the prostate, and I did some research around that. And the end of that story is that today, 30 plus years later, today we know that testosterone doesn't cause prostate cancer like we thought that it did. And that in fact, there are many men even who have prostate cancer who have been successfully treated with testosterone without there appearing to be an increased risk. That's what we know today based on the evidence. But it took a while for anyone to start figuring out that these men actually might benefit in a whole variety of ways, as today we know. So testosterone is not just about sex. It's about muscle and fat and sense of well-being and mood and energy and a sense of vitality. It's about bone density and having appropriate red blood cell count. So there are people with anemia, for example, who have low levels of testosterone, and their anemia gets better when they get treated. Today we know that testosterone is, in my opinion, probably the single most important chemical that regulates so many important health and medical related issues. It's hard to imagine anything else that even competes with that. But we didn't know that 30 years ago.